Dr. B?
Yes, ma'am.
Dr. Gotcher is attempting to unite with the meeting. He's having technical difficulties, but he'll hopefully join us soon.
Okay, thank you. We apologize for the delay, everyone. Welcome, Dr. Gocher.
Yes, that was a little frustrating. I had the wrong invitation. We've had so many emails, I couldn't get my invitation together. So we're here. Thanks, everybody.
So we can hear you.
After 5. Sorry for the slight delay there. But what I would like to do, if it's okay with everyone, is very slightly change what our proposed agenda is in terms of the order of things, because I would like to get the meeting together and get it started before we have our public forum. And I think if there's no other problems with that, that will just take a minute or two. That way we will officially be in a meeting. So first order of business is call to order. And I want the second order of business to be the roll call so we can each ascertain that we're present.
Dr. Gocher, can you turn your camera on, please?
Thought it was on, sorry.
Nope, there we go.
Okay, good.
There we go, thank you.
Sorry about that. So the next order of business I would like to have is roll call and then establishment of a quorum, and then we can go to the public forum quickly. So Narda, if you're online, if you will do a brief roll call for us.
Certainly. Drake? Drake?
Yes. Here.
Gocher?
Here.
Hurt?
Present.
Jacobs?
Here.
O'Brien?
Present.
Jamia?
Here.
Sousa?
Here.
Wagner?
Present.
Buchanan?
Present.
Thank you. And Dr. David Sanders. Okay, all counted for, thank you.
So we have established a quorum, and so the next order of business will be our public forum. And Mayor Jacobs, if you are physically present, I think if you would be kind enough to assist us with that aspect of the meeting, we would really appreciate that.
Yes. Thank you, Dr. Gocher. And thank the board for allowing this to happen. We have 13 people that are present. So giving them 3 minutes each, would it be okay with the board if we allow everyone to speak this evening instead of just 10, which would be 30 minutes?
Let's save them in here.
Certainly fine with me.
Thank you. And we've also explained to everyone that there will be a 3-minute time limit. There are to be no personal attacks on any board member, as well as no profanity. So those are the rules. And I'd also like to thank my staff that's actually has facilitated this. So let's go ahead and get started with the first public commenter, please. And sir, please state your name and address for the record.
My name is Bob Fisher. My address is 7851 Ramsgate Drive, Knoxville, Tennessee, 37919. I've been a resident of Knoxville since 1968. I've worked at UPS and been a proud Teamster since 1977. I've been on safety committees for most of that time. Something that's bothered me through this process is an absolute lack of integrity from the top, from literally the President of the United States down through our local officials during this whole process. The importance of integrity in maintaining the public trust cannot be overstated. I've got 3 minutes, so I'm going to make my points and forgive my abrupt and blunt approach. Locally, this process has been marred by gaslighting, outright lies, and misinformation, particularly in these Board of Health meetings. Case in point, 2 meetings ago, we had following statements. From a media and historic perspective, others have said we don't need to wear masks. What changed? We had a question on whether or not a cloth mask is an acceptable environmental in an uncontrolled environment makes a difference, and if there are studies that says it helps. These were unwarranted attacks on the board, catching the board unawares. You weren't able to have that information. I have this information right here. There's a VCU study. It's being peer reviewed right now. It was released August 5th. You can find it on the internet. It took me 2 minutes. We're to the point of letting exceptions override the rules here. We are in a public health crisis. We are on track to have 35,000 active cases by September 26th. That's the opening day of football. On the traditional Alabama game, we're on track to have over 100,000 active cases. We only have 480,000 people. We are on track to have this entire town infected by November. We need action. As to whether or not closing the bars is the correct action, we should have some mitigating circumstance that's going to work at least as well as that put in place by the end of this meeting. If we're not going to close bars, we need to close the schools. If we're not going to close the schools or close the bars, we're going to need to shut back down nursing homes. We are going to have to do something, ladies and gentlemen. This infection this is a public health crisis. This is not an economic crisis. We're looking at over 1,500 beds short by the end of October. We cannot sustain these numbers. Thank you very much.
Thank you, Mr. Fisher. Sir, please say your name and address for the record.
Yes, sir. My name is Charles Smith, and I live at 1007 Hunters Green Road in Knoxville. Thank you for the time. As it's been said, we're in a public health crisis, and it's not the time to defer the judgment and leadership of whomever tweets the most incendiary claim or files the most frivolous lawsuit or decides that a publicity stunt is more important than the public well-being. The pandemic is getting worse. All levels of government, our elected officials are failing us because they have vested stake in furthering their own ideological positions at the expense of scientific and public health data. At this crucial time, we need to keep political pressure off the health board, who are using the best available data to guide public policy. If anything, we need to be applying pressure using our vote and our wallets on elected officials and businesses who have decided that their own interests outweigh the public. Governor Lee has chosen to avoid and ignore the advice of both the White House Task Force and the State Attorney General by refusing to close bars, limit indoor dining, and issue a mask mandate. We are lucky in Knox County to have a local board to evaluate and guide public health policy. Members of the board are nominated by their local professional society and are approved by the county commission. The mayor, the superintendent, the county health director are also members. The board's composition and authority is granted by the Tennessee Annotated Code, which says the board can adopt and enforce rules and regulations necessary and appropriate to protect the general health of the county and control preventable disease. To date, this authority has been either undermined or ignored by the county government and by some publicity-seeking entities. Contact information for the board is public record. Social media has made it impossible for anyone at any time to not get public feedback. Publicity and political stunts like dead-on-arrival lawsuits, blatant disregard for and not enforcing public health regulations, refusing to wear a mask in public, and harassing our service employees who are just trying to enforce a mandate of businesses that are compliant is a disservice to our community. Businesses are under unique strain right now, and this needs to be recognized. Unfortunately, the aid from the federal government mostly went to well-connected corporate entities and not those small businesses that justifiably needed it. This is where the energy of the government and the business community should go. If I decide to visit a bar before 8 p.m., I've accepted and increased the chance of getting COVID, but I've also increased the chance of spreading the disease to the people around me who had no say in my decision. We live in a state where there is no guarantee everyone has health insurance, which makes the decision to ignore legally rendered public health guidelines even more horrific. We need to stop and think about the people we want to be. At the end of this, we need to be proud that we banded together and supported each other, that we came together to stop the spread, lower the already too high death toll. The politically and motivated self-serving actions of a vocal minority have made this impossible so far. Thank you.
Thank you, sir. Sir, please state your name and address for the record.
My name is Chuck Ward, and I'm at 11220 Outlet Drive, Knoxville, Tennessee. Like I said, my name is Chuck Ward. I'm the owner of Cotton Eye Joe, and I'd like to speak a little bit on the ordered bars. I'd like to speak my thoughts about my bar and other local bars. Since the Phase 3 opening, which includes other businesses other than just bars, we have taken every precaution we possibly could have, including but not limited to installation of plexiglass throughout the entrance, the bars, etc. Total sterilization of the entire club every week. We've made it a point to correctly inform our patrons with signage and such importance of social distancing and mask. We've required masks upon entrance and any time that they're not sitting at their table, even making our patrons wear a mask on the dance floor. Upon entering the bar, their temperature is taken, hand sanitizer is provided, the 3 questions are asked, and masks are provided if they don't have one. Us enforcing these rules have made some patrons not want to come to our bar due to their beliefs. But we are happy to continue to do this if it means we can keep our bars open, even if we lose some customers. I feel possibly the reason for the increase in the COVID cases is stemming from lots of issues, not just the bars reopening. Since Phase 3 has opened, we've had gyms open, salons, bars, massage businesses, etc. I also believe that there's been a large increase in traveling since Phase 3 has opened, which could also bring cases back to Knox County. To designate the increase has been caused strictly by bars opening, I don't feel like we have enough proof for that. With that being said, where there's a will, there's a way. We all know that if Knox County residents choose that they don't want to go to a bar in Knox County, they can drive 10 minutes in any direction of Knox County lines and be at a bar in a surrounding county. That choosing not to shut our bars down. Our county needs the revenue that our residents will take elsewhere. There's already been several hundred thousands of dollars lost since we shut our bar down the first time. We pay a lot of taxes on liquor sales that benefit our county. This not only affects our county and bar owners, it affects every employee that we have had since the government took the money away on 7/31. What will happen when the children return to school? There will be so much more exposure. Kids cannot social distance. We know this. Me personally, I've done everything possible to make sure my patrons and employees stay safe and follow the rules. I'm sure every local bar has done the same. This affects their income, their livelihood, and their life. I myself have invested everything that I have in this bar to keep it open. And the last thing that I can do is shut it down again for the scared fact of thinking that we may lose everything we've got. We've worked hard to, try to keep our business successful, only to be singled out as the cause of the spread. I cannot see any proof that this has been proven. Knox County residents will not stay home. Thank you very much. Thank you, Mary Jacobs. You've been the only one that's really supported us to this point, and I appreciate it.
Next, please. Please state your name and address, sir.
Nathan Robinette, 234 Brookview Center Way, Knoxville, Tennessee, 37919. I'm with the Casual Pint, and we're a small business owner too. And I would like to thank Mayor Jacobs and his team for allowing us to come and do this forum, and being surrounded by this group of business leaders and community activists is really, really good to see. So I appreciate the turnout and the opportunity. I would like to speak to the order specifically and just say that I think it's unfair. We as a business community are doing everything that we have been presented with as far as cleanliness, sanitation, keeping our customers safe, keeping our staff members safe and healthy. We have done nothing but follow all of the guidelines, all the recommendations, and to have an order come down telling us that we've got to close is just simply unfair. We have put our life savings into this. Everyone, all small business owners have, and our small business economy is the backbone of our society and our community. And we've got to protect it. We can't shut it down. We've got to have the opportunity to be able to run our businesses and run our businesses safely. We're not out there to get our customers sick. COVID is not born and living in the bars. It's really an unfair attack on that specific category. We've got to come up with a better solution other than just closing everything down and closing down our economy. That's not the solution. When this thing goes away, we're not going to have anything to come back to if we don't continue to keep our businesses and our economy moving. It's really, really disheartening to think that this could happen again as far as an order or a complete closure coming down. I would like to say to Dr. O'Brien and the rest of the board that I would be in support of the curfew idea. I don't think that it's a permanent solution by any stretch of the imagination. It doesn't help some of the business in town, like my friend from Cotton Eye Joe that just spoke, but it at least gives us an opportunity to stay open and continue to operate. So temporary solution is fine with that. I would support that, but we've got to continue the conversation and really move forward in a better, more proactive direction to keep our economy moving. And lastly, I would like to say that we just need to do a better job of educating our community, especially the demographic that's been targeted as the demographic that the 21 to 35s that are the ones that are resulting in the rapid spread. We've got to educate that demographic better. And you all as a board have to come up with a better platform, better messaging to communicate with those people on the platforms that they're looking at, whether it be Facebook, Twitter, pick something. We've got to get that message out to that community so we can stay open and stay safe and stay healthy. Thank you all for the opportunity.
Thank you. Sir, please state your name and address. Thank you.
My name is Troy Hale, 8039 Ray Mears Boulevard in Knoxville. I'm the owner of Buckethead Tavern. We at Buckethead Tavern are a family of 25, a dysfunctional family sometimes, but a family nonetheless. A lot of what I had prepared to say has already been stated. And one thing I do want to say to start off with is a thank you to each and every one of you on our Board of Health. I appreciate the effort and energy that you all put into your responsibilities, and I do not envy where you all sit right now because we're obviously in unprecedented and uncharted territory. So thank you very, very much for your diligence on this pandemic. I would take a little bit of difference with the statement earlier that we're not in an economic crisis. As a small business owner, I can promise you we are in an economic crisis. One can't afford to outdo the other, and we obviously need to take care of everything we can diligently through this pandemic. And as a small business owner, we don't take it lightly. We've done, when we were first shuttered in March and then reopened the 1st of May, we have done everything asked of us by this board. And we've done it diligently. I'm not going to go through all the specifics the others have mentioned. We haven't had a single case reported at our premise, much as most small bars, taverns. However, our business, when we were open for 13 weeks, you all work with statistics and numeric numbers. That's what drives your decisions, I would think. They can be interpreted different, but the numbers don't lie. A few numbers for you. For 13 weeks of being open, we were down 38% versus our norms during that time. That's not a sustainable model. However, we did it. Since we were able to shut down again, since we were told to shut down, we surveyed and did some reconnaissance of establishments around us, and we were one of only 2 of 14 that decided to close and be a part of this. Now, I'm not knocking other people doing it. They're simply, you either abide by this rule or you become somewhat rogue, and it's put small business in a very precarious situation trying to survive. Since we stayed open, since we were closed and did our delivery, we all know the restaurants are still open. We've had $134 in sales on Monday and 207 sales on Tuesday. That's down about 97% from our norm. If the demographics are the 20 to 30-year-olds, we also know that they frequent establishments after 9 p.m. Dr. O'Brien, thank you very much for the issue or the amendment for the 10 p.m. But it would seem that if we close at 10, they can go to restaurants and places that have bar areas and patios afterwards. Anyway, I'm passionate about this, and again, it's an honor to speak to you, and thank you very, very much for your time.
Thank you, Mr. Hale. Next, please. Please state your name and address.
My name is David Hamblin, 9430 South North Shore Drive here in Knoxville, Tennessee. Board members, Mayor Jacobs, thank you for this opportunity to speak this afternoon. As an engineer at a large Fortune 500 company in the aerospace industry and the husband of someone who owns a prominent West Knoxville restaurant, I can assure you my wife and I have certainly felt the effects of this pandemic. My company instituted 2 mandatory 1-week furloughs, and my wife has seen a 40% year-over-year drop in revenue in the past month. So I'm grateful that we surely haven't experienced the effects of this pandemic as bad as others have, but we still have been affected by it in impactful ways that we, in fact, no one could have predicted just a year ago. All of that being said, I do think there is a productive and unified path forward to getting our community back to some sense of normalcy. It's called science, patience, and empathy. Through benchmarking that's worked in other municipalities and even countries around the world, I think we are putting science first and not letting emotions drive impulsive decision-making by enforcing the mask mandate. Now, you might be someone who is more skeptical of the science, and that's okay. But please try and think about this from a different standpoint. One thing that's a fact is that if left unchecked, the spread of this disease can lead to the straining of healthcare capacity, as we've witnessed in places like New York City and Houston. And as a consequence, can limit the ability of our healthcare workers to assist in caring for people who might be suffering from other critical conditions. So when you make that decision to wear a mask, I would encourage everyone to think of it not as a violation of your personal liberty, but as a way to potentially help a family member, friend, or neighbor to not get sick. Second, I think we need to exercise patience in the process of understanding and subsequently fighting this novel disease. Based on the data we're seeing in Knox County, do I think it's the right time to reopen public schools? No, I do not. I fear that it will be extremely difficult to enforce rules around social distancing and mask wearing, and that this combination of higher risk behavior will end up increasing the transmission of this virus to our children and teachers. By exercising patience in the process, we can drive towards sustainable openings of our schools and businesses that won't lead to unmitigated spread of the virus and cause more shutdowns and closings as we're already observing in the surrounding areas. Finally, we should have empathy for our friends and neighbors. We all might differ in our opinions on the response to the pandemic in these unprecedented times, but I think we all really do want the people within our community to be healthy and to not suffer from this or any other disease. By wearing a mask, I think we can do our part to show that we care for others in our community and also honor the healthcare workers who are fighting this thing on the front lines, both locally and abroad. While some people might not see the importance of mask wearing to the same degree as others, it might be important to note that many people might feel more comfortable shopping in places where them wearing a mask is mandated. So when you make that decision to wear your mask, whether you think it's important or not, you are helping both business owners and other customers all over Knox County feel safer while working and shopping. And as a result, our residents as a whole will feel safer venturing out and spending money within the community. Thank you very much for the time.
Thank you, sir. Sir, please state your name and address for the record.
My name is Aaron Thompson, 418 South K Street. Hello, and thank you for allowing us the time to speak about the decision to close bars in Knox County. My name is Aaron Thompson. As I said, I own Sapphire on Gay Street. Today, I want to speak on behalf of bars that also operate as restaurants. First of all, my team and I believe that COVID-19 is a real threat, and we take it very seriously. We've taken every precaution that we've been asked so far. We know that making decisions that affect the local community is not an easy decision, not an easy task. You define bars as establishments where over 50% of total sales are made up of alcoholic beverages. Respectfully, we believe that bars cannot be painted with such a broad brush. For example, Sapphire has served a full-service food menu since 2006. We've employed executive chefs, served prefix dinners, competed in food competitions, donated thousands to charity through fundraising dinners, and continue to craft food menus that are comprised mostly of locally sourced ingredients. In 2019, we sold over $250,000 in food. On a yearly average, that number is between $200,000 and $300,000. While it is true that our alcohol sales make up a larger percentage of our overall sales, it is not true, fair, or just to define us as just a bar. Sapphire is an example of why this arbitrary 50% ruling is unfair. There are many bars and breweries that operate as restaurants in Knox County. We make the case that bars operating under certain restrictions are no more dangerous than the restaurants that are allowed to remain open. How is it different? Sitting at a table inside Sapphire where tables are spaced every 6 feet to sitting at a table inside your local corporate restaurant chain. The only difference is that our buying power is lower, our margins are thinner, and our existence is solely dependent upon being allowed to remain open. We have two alternative solutions we ask you to please consider. Plan A, create a ruling that allows bars to reopen that have a proven track record of operating as a restaurant, despite their high alcohol sales. This can be ascertained by looking at their menu or visiting their facility. And additionally, allow bars without that track record the ability to formulate a new business model that includes a food menu, outside catering, or utilizes a food truck. Or Plan B, keep all the bars closed. Provide financial assistance to help us pay our fixed costs and payroll. This board has closed us right after we've used all our federal and state aid that was available back in March. All we ask for is an even playing field. We are allowed to compete in the market we have all contributed to. It is not fair to ask us to compete with takeout sales when dine-in restaurants continue to operate without the same restrictions. Thank you for your time.
Thank you. Sir, please state your name and address for the record. Thank you.
Good evening. I'm Steve Seifried. I live on Snowden Drive, Knoxville 37912. Mayor Jacobs, his staff, and also the Knox County Board of Health, thank you for hosting us this evening. I appreciate the opportunity to share my thoughts. I'll email these comments to you so you can have these for public record if you'd like. I strongly support the recent decisions the board has made towards slowing the spread of COVID-19 infections, along with saving lives and helping maintain manageable hospital patient loads. I believe that their work will help our economy to recover more quickly as a result. First, as an understanding of this disease just is continuing to evolve, a few basic behaviors are agreed upon by the broad medical community. The ones that have been proven to be effective include maintaining a safe physical distance, washing your hands, wearing face coverings, and limiting the size and density of social gatherings. From what I'm seeing and reading, our health board's recent decisions represent the best of what prevailing science and frontline healthcare providers are asking of us every day and everywhere. Secondly, I affirm that the Board of Health has the legal authority to protect the health of Knox County citizens, as has been mentioned by a few others this evening. The board is specifically responsible and authorized to adopt rules and regulations that protect us as citizens and state law, and to recent Governor Lee's executive orders confirm that as well. So enough said there. Last, I believe that both the health and economic threats that we face today in Knox County are not being overstated and are necessarily related. Unless we as a community do everything we can to slow this growing viral outbreak, our medical system, UT, Pellissippi State Community College, on and on and on, and all our local businesses, which are suffering tremendously right now, will only suffer more. You've all got a needle to thread here, and we really appreciate your hard work. We really appreciate the way you're dealing with this. So I wear a mask because I believe it protects others around me, my family, and I think it will hasten our economic recovery. I know that many, many others in Knox County agree with me. I strongly support and I deeply appreciate the work of everybody on this call, and I encourage others to do the same. Again, thank you very much. And I really appreciate all the comments that my fellow citizens are also sharing tonight. I think this has been a great discussion. Thank you.
Thank you, sir. Please state your name and address for the record. Thank you.
Allison Efferson. I live at 9505 Fortress Lane, Knoxville, 37922. Thank you, board members. Thank you, Mayor Jacobs. Thank you, staff, for having us here. I come at this from a little different perspective. I'm a mental health practitioner. And so I'm going to just give my comments as both a citizen of Knox County and as a mental health practitioner. And so here are my primary concerns about the COVID-19 face covering regulation. Because you're board members of an unelected position, discharging your duty to protect the health of the citizens of Knox County, you have the added burden to consider the degree to which your decisions will harm those affected. As unelected officials, you bear a far greater burden to weigh not just the physical health, which we all agree you care about, but the mental health and the overall welfare of those you're charged to protect. For many I speak to in the community, that the face mask regulation is viewed as an unnecessarily punitive and restrictive measure, the necessity of which many think is highly debatable. I get it, the science is still out on this one. And so we're all trying to navigate it as best we can, but you don't have full buy-in. And that's part of the problem. And as a board, you've used science. I've read the original July 3rd regulation. You've used science to justify the proposal and the passing of the regulation, but you've also exercised judgment to justify the 13 exceptions within the regulation. But in deciding to pass it, you've eliminated our ability to exercise our own judgment as to how to best conduct our lives. Now, the mental health implications for removing personal agency to make informed decisions for oneself and the ability to provide for oneself and others can't be overstated. We're in a mental health crisis as a result of COVID, and it's related to many things, not the least of which is the fear of the disease itself, but also the restriction of personal liberties and the economic hardships. As a profession, we're seeing alarming spikes in depression, anxiety, and in suicides, and you know that that's happened here in Knoxville. We've had devastating effects related to suicides. And those numbers matter too, and that science matters too. We're witnessing neighbors turn on neighbors and people harassing one another sometimes. And when you remove a person's ability to make basic choices for themselves and their decision to protect one's health as they see fit, in the absence of any guidance, and I would really implore you to provide guidance, when does this end? When is the bright line for when we can see this measure removed? People lose hope, and they lose hope when they feel like they don't have choices or recourse. And so I would just ask the board, I know that you guys mean the best for us. Please give us guidance as to when it will stop. Thank you.
Thank you. Please state your name and address for the record, sir.
Hello, my name is Jeff Bilry. I live on Cala Crossing Lane. I just want to say that during this pandemic, we've experienced a record drop in GDP, and we have had experienced lockdowns and closures of businesses nationwide. According to The Hill, 79% of Americans support a nationwide mask mandate. Also, according to The Hill, 40% more people would be more apt to wearing a mask if their municipality mandated it. Of the people who are against wearing a mask, I've heard a million excuses as to why they don't want to wear a mask. Science has unequivocally proven that these excuses are just that, excuses, not factual. The CDC says we can avoid lockdowns and mass spread of a novel coronavirus if upwards of 90% of the population was wearing a mask. There's a huge debate amongst Republicans as to the legality of the mask mandate. Tennessee Attorney General Herbert Slattery stated that the mask mandates are constitutional in late July. Citing the 1905 U.S. Supreme Court case Jacobson versus Massachusetts, Slattery points out the Supreme Court has recognized that over a century that the community has the right to protect itself against an epidemic of disease which threatens the safety of its members. In such circumstances, courts can only overturn orders that have no real or substantial relation to protecting public health or those that present a plain, palpable invasion of clearly protected rights. In a nutshell, your rights end where my rights begin. You can make whatever bad decisions that you want to make. However, if those bad decisions negatively affect me, then you've just violated my constitutional rights. I understand that the GOP is pushing the end liability to companies for coronavirus, but that isn't the solution. Liability only protects companies' money, but it doesn't protect the company's greatest assets, which are their consumers and employees. In April of 1997, the WWF introduced Kane, the wrestler, aka Glenn Jacobs, our county mayor. He made a career of wearing a mask for entertainment purposes. I find it extremely odd that Glenn Jacobs is a person who's against wearing a mask for protecting the community that is elected to serve. Fair enough. After all, at the end of it, I think a lot of that is just absolutely silly. I think that the being against the mask mandate is currently a publicity stunt. And I think that this is a health issue, not a Democrat or Republican issue. The decisions we make today affect far too many people for us to make the wrong decisions here in these meetings. All we know is that we're for the mask mandate. You want to be reelected and you want people to vote for you. I understand all of these things, but at the same time, this is not a Democrat or Republican issue. Sorry, I had to cut half my speech out right there, but hopefully these people get a chance to speak. Thank you.
Thank you, sir. Please state your name and address for the record.
Deborah Stafford, 7916 Whitcomb Road, Powell, Tennessee. And thank you very much for having me. I'm going to go quickly because I have a lot I want to say. According to the National Sex Violence Resource Center, 1 in 5 women in the U.S. has reported attempted or completed rapes. A number of female patients have come to me terrified with the masking order due to their past assaults, which included objects being placed over their faces during the acts of violence to prevent screaming. Mandatory masking is a women's health issue, and it's further exploiting the harm done to sexual abuse survivors. Stat News, June 3rd, 2020, posted an article, Which Death Do They Choose? Many Black men fear wearing a mask more than coronavirus. Black men across the U.S. being targeted because they were Black and wearing masks. Black men who choose not to wear face masks face ostracism for the mask holes. Mandatory masking is further harming Black men in racial relations. Mental health exacerbations, as a prior resident stated, are skyrocketing. My clinic between June 2019 and June 2020 saw a jump in ICD-10 codes for mental health problems from 4.3% to 7.5%. Mental health needs have almost doubled at my clinic. I have patients under 8 years old who are telling me they want to die because of what has happened to their social groups, because of the isolation they face. Multiple patients and friends who have had COVID-19 have told me that the Knox County Health Department has told them as long as they are fever-free at least 3 days, they are no longer contagious. Now, this is hearsay. I don't know if there's a breakdown in communication, But it does not make sense that someone who actively has COVID-19, even if they are still symptomatic but without a fever, are not a threat, but an asymptomatic person is. It isn't logical. Several studies have found that asymptomatic transmission of COVID-19 has not occurred. One study found out of 455 contact tracing from one asymptomatic individual, not a single case of active COVID-19 has occurred. On June 9, 2020, the World Health Technical Lead on COVID-19 stated the actual rates of asymptomatic transmission is highly unlikely, and the vast majority of spread comes from symptomatic patients spreading droplets. There is ongoing evidence that COVID-19 may be airborne or it may be droplet. We know from OSHA and the CDC that droplet precautions require the sick person to wear a surgical mask, and airborne precautions require the unsick person to wear an N95. Masking in nowhere outlines anything other than something covering your face. Well over 75% of my adult population I've seen in the past 5 months at my clinic have had a weight gain. We know that there is a role between obesity and increasing IL-6 cytokine. Emerging research suggests that IL-6 and CRP are good clinical indicators for the need of mechanical ventilation for active COVID-19 patients. Our society should be attacking obesity and encouraging exercise and trying to address the health disparities that increase the risk of COVID-19. But just this past Sunday, I was kicked out of Tenova Health and Fitness because I had a medical exemption for a mask, and they advised me after a month of working out, I'm no longer allowed in because they don't care about your medical exemptions. I would ask you all, what are you doing to maintain our medical exemptions? To summarize, asymptomatic transmission appears unlikely, and there is a lot of confusion. You all are increasing health disparities. Thank you.
Thank you. Sir, please state your name and address.
Victor Romero, 4632 Ellistown Road, 37924. I try not to speak of what I am not very well informed about. I do not know your credentials, and I do not know who decided that you were the guys to do the job. And I do not know the law that is behind you that makes you think that you can, from your perch, decide over the lives and businesses of all of us. I do know, however, that I have never seen your name on a ballot, except for you, Mayor. I do know that I have never voted for you, and I do know that you have no right under the Constitution of the United States to make it a criminal act for a business to remain open or for somebody not wear a mask. I bet you have not missed a single paycheck either. In my case, the Knox County Health Department still owes me 40 hours worth of wages and benefits when I was arbitrarily forced to quarantine even after resulting on a negative test and not having evidence of being in contact with anybody with COVID-19. It is very easy to sit there and make decisions when it's not your pocket that is getting hit. The numbers show no real evidence as to why you're taking such drastic measures, limiting the free will of the citizens of Knox County. It is a shame that you have betrayed the public's trust by inflating data, Knox County Health Department, increasing fear and potentially destroying local economy while allowing corporations to remain open. You do not represent the majority of the citizens in Knox County and do not have the right to decide to make businesses require anything specific from any patron. That is a business owner decision, and no one should be forced to do anything they do not want to do. You are not elected officials. You cannot make law. This country was founded on the principles of government by the people and for the people. Arbitrary decisions like this only create a precedent that endangers our rights and liberties, and it is your duty as citizens to take a stand against tyranny. Our liberties and our way of life is directly under attack at this moment, and I urge you to take ethical decisions that will protect our health, but that will also protect our rights to be free and to the pursuit of happiness. I was raised in a country where you don't even have the right to defend yourself, where corruption is the only way things move, and where the common idea is that you can only get ahead by screwing somebody over. There was 1,653 deaths, but due to the flu in 2017, there has been 40 deaths from the moment the COVID started until right now. Even if that data was not inflated or manipulated, a positive case does not mean a death sentence. Most cases don't even have more than mild symptoms and require no more treatment than staying at home and letting it run its course. It should be the people's right to choose to provide as advisory role and not to make laws because it's not their place. Thank you very much.
Thank you, sir. Sir, please say your name and address for the record.
Russell Ray, 713 East Emory Road. I'm a physician here in Knoxville. I practiced in hospital. I've practiced in the emergency room. I've been in urgent care. Currently, I'm working in a primary care office. And so I'd like to share this from maybe a little bit different standpoint than some of the others have. Those of us that went to medical school, this is kind of a refresher course. We know that vaccines, which everyone has touted as being the answer to this pandemic, vaccines work by exposing us to a little bit of the microbe repeatedly, so that our bodies will give it the immune response that God gave us to develop immunity against that particular microbe. We also know that herd immunity works the same way, that you are exposed to a little bit of the virus repeatedly so that your body will respond with an immune response so that you can fight it off. So the end of the pandemic is not necessarily isolating us until it goes away, because it's not going to go away. I have a patient who is a microbiologist who has stated that eventually everyone will be exposed to this virus. This virus has a death rate of 0.00046 around the world. And that's taken from the WHO numbers that have been posted. Both the CDC and the WHO have stated to us that asymptomatic carriage does not spread the disease. We've heard from several of the other speakers tonight. Therefore, shutting down businesses, shutting down schools is not going to stop this from spreading. It's actually going to prolong the existence of this virus in our community. We need to get everyone exposed so that everyone will develop immunity. The second part of this is the requirement for the face masks. As medical providers, we know that face masks work wonderfully in the surgical arena, because the surgeon touches them twice, once to put it on, once to take it off. Out in the community, people touch their masks repeatedly. They pull them down to talk, they pull them down because they can't breathe, they pull them down to drink, they pull them down to eat. Each time they touch this mask, it becomes a reservoir for their current microbial environment, and it translates to their hands, which, if they're in the store, translates to touching whatever that is that they're looking at the store. There are other issues that arise from that too, in being able to see people's emotions, read their faces, understand what they are saying. Thank you.
Thank you, sir. That was everybody. And again, I would like to thank the board very much for allowing public forum. Dr. Gocher, back to you, sir.
Thank you very much, Mayor Jacobson, and thanks to our participants this evening. We certainly appreciate your input. The next item on our agenda is approval of minutes from the July 29, 2020 meeting. These have been distributed to everyone, and hopefully everybody's had an opportunity to look over these. And so I would first ask if there are any additions, corrections, deletions to the minutes of the meeting from July 29, 2020. Hearing none, I would accept a motion for approval in a second, please.
So moved.
Second.
We have a motion and a second. Any further discussion on that? If not, Narda, if you'll take a roll call vote for that, please.
Yes. Dianna Drake,
Yes.
Gocher,
Yes.
Hurt,
Yes.
Jacobs,
Yes.
O'Brien,
Yes.
Shamia,
Yes.
Sousa,
Yes.
Wagner.
Yes.
Thank you. Passed unanimously. Thank you.
Thank you. You have approved the minutes from July 29. The next item on the agenda is to set the agenda. We have a proposed revised agenda that has been distributed to everyone. Does everyone have a copy of that revised agenda?
I do not have the revised one, Dr. Gocher, in front of me. I don't think I have the one that was last set, but a point of personal order, could I just ask a question?
Sure.
One of the things that is put up for the agenda are a couple of items that I wish to bring up for discussion. I just want to say to the public now, one of those is one that I put together a proposal to bring to everybody here that still, I think, is a work in progress. What I put up initially was the initial draft, because we have to work so quickly to get to a meeting with only 7 days in between, that the work to get that one item prepared to the extent I think that it would be really ready for our review and for a vote is just not there. And this concerns the one on the 25 and under regulation, trying to regulate space and numbers of people, in other words, crowds. I've got to tell the public, I really appreciate all of the feedback we've gotten. There have been hundreds of emails. I have gotten phone calls, and I don't want people to be angry. We listen. And I'll be honest, what was put up was that first draft. There are issues in that draft, and I will say some of those issues include exclusions that were forgotten to be put in there. That's working with other people helping me and trying to do a regular job and help do things for this board and try to keep up with all of it and read it over and over, and things are missed. So, we missed out in this proposal that'll be there when I bring it formally. We need to exclude schools as an example. We need to talk about personal private property versus private property open to the public, things of that sort. So I think discussions need to be had on what I want to propose to our group. And I want to take that off the agenda, to table it for a week, and to have discussions with Mr. Sanders as our board attorney and others in the public that can help to see if we can come to something that, if needed next week, I will bring back at that time. But I don't wish to bring it up. I know there's been a lot of concern in the community, and I don't want it misread. There was no desire on my part for us to do something that would limit people's ability to gather. It's just limit people's ability to gather in a small space, and not to do so in certain things that are constitutionally mandated. We would not do it because of the schools. We cannot do that in that regard, and also some related to private property that come into play. So, that's one thing that was supposed to be on the agenda, and I do want just to make sure that that comes off for more work.
Dr. O'Brien, if you would offer that removal for this week, or to postpone definitely discussion on that as an amendment to the motion that we have before us to approve the minutes. I think we have a motion for us.
I want to approve the minutes with an amendment to remove my proposed public health regulation related to groups of 25 and under.
So we have a motion. Do we have a second on that?
Just one clarification. We approved the minutes. I think we're talking about setting the agenda now.
Okay, so we need to, let's back up just a minute, Dr. O'Brien. And I appreciate your comments, but in order to do this, we first need to have a motion to approve the agenda. Well, I think we need to at least have a motion to approve in a second for discussion, and then we can enter your amendment in during that discussion.
Dr. Gocher, I'm not sure I have I have an agenda in front of me. It may not be the latest version. Is it possible just momentarily to project the precise agenda which we're referring to?
The one that I have has 13 items on it, with 13 being adjournment. And if we could put that up for everyone. And
Can someone share that? If not, I've got it that I could potentially share.
Okay. remember that I moved a few things around to accommodate the public forum, but other than that, it's, I didn't change any of that.
I apologize. My agenda that I have has 12 items on it, so I
Dr. B, do you want me to share it, or can you guys do it?
We, I don't think anybody in here has it. So
Okay.
We didn't anticipate needing to share that.
Okay, I can share it if that helps. Hang on a sec.
That would be greatly appreciated.
All right, are you seeing the?
That's it. That's
13?
the
Okay.
latest one.
Yeah, and I received this a little bit earlier today, just in case Dr. Gocher couldn't make it because he was on call this evening.
Okay, that's all I need. We can go back.
Okay, did you want to stop sharing? Does anyone want to keep looking at it?
Dr. Seuss, if it's okay, maybe we could would it be okay to leave that up as we're discussing it?
Sure, that's fine with me.
So what we need to move ahead is a motion to approve the agenda and a second, and then during discussion, we can talk about Dr. O'Brien's point number 11 or agenda item number 11, if that's okay.
I'll make a motion to accept the revised agenda.
I second.
Okay, we have a motion and a second. Any discussion on approval of the agenda?
Dr. Gocher, I'm asked to do a friendly amendment or removal of item 11 for further evaluation and work by myself with our attorney, Mr. Sanders, and others as needed.
If the board will accept that as a friendly amendment, and Mr. Sanders, is that okay without a roll call vote? Yeah.
Apologize, I was muted. Yes, it's fine without a roll call vote. You're not required to do a roll call vote, I don't believe here.
Okay. So with that amendment of deleting item number 11 in the agenda, we have a motion and a second for approval. Is there any further discussion on the agenda as it now stands? If not, since we're ready for a vote, and we'll need a roll call vote on this. So Nora, if you'll go through the roll call, please.
Certainly. Drake?
Yes.
Gotcher?
Yes.
Hurt?
Yes.
Jacobs?
Yes.
O'Brien?
Yes.
Shamia?
Yes.
Souza?
Yes.
And Wagner?
Yes.
Thank you.
Yes.
We have approved the revised agenda. The next item on the agenda is the benchmark presentation by Knox County Health Department, and I'll turn this over to Dr. Buchanan at this time.
Oh, wait, in process. So waiting for, there we go, screen sharing. Oh, that's not it. There it is. There we go. Okay, so here's our first benchmark, the sustained reduction or stability in new cases for 14 days. This benchmark continues to be red because we saw one 3-day trend of red flags in the past 14 days. However, we have not seen any flags in the past 6 days, which is encouraging. Due to that 3-day trend, we continue to have it as red. The lower volume of new cases we have seen over the past few days is certainly encouraging to all of us. But doesn't mean the virus is gone. It just means we have a 6-day no flags, and we're happy about that, but continue to be red. Second benchmark, community-wide sustained and increased diagnostic testing with consistent or decreased test results reporting turnaround time. And for this benchmark, we have two different graphs, one showing volume of testing, and again, a reminder that this is really just a sample of the volume of testing, as the Knox County Health Department can't see all of the testing that's being done by private providers and others, but we see most of it. The trend is still in a positive direction. I'll remind everybody that also this data is from last week, so that we have a full week of data to look at. So next week we'll be reporting out this week's data. So continues to go up, and our actually our turnaround time has gone down slightly. So this benchmark is at green. Third benchmark, sustained or increased public health capability. Again, this is based on my staff and the support staff that we've hired being able to reach out to cases within the first 24 hours of knowing about the case, and with contacts within the first 48 hours of being aware of the contact. We continue to be able to do that, and I'm happy that my staff continues to be able to do that. So this benchmark remains at green. The fourth benchmark, which is healthcare system capabilities, remaining within current or forecasted surge capacity. This benchmark remains at yellow. This is a benchmark that we decide in concert with our hospital partners who are meeting regularly. It's based on COVID patients and pending COVID patients, and bed availability, ICU bed availability, and ventilator availability. And Dr. Shamia will be speaking more specifically about hospital capacity and what they're seeing at UT here momentarily. Our fifth benchmark, sustained or decreased COVID-19 related death rate for identified positive or probable cases. Unfortunately, this benchmark continues to be at red as we've continued to see deaths regularly from COVID related illnesses. Nearly half of all the COVID related deaths we've seen have happened in the past 14 days in Knox County. So that's a concerning trend. We hope that that will start to change over time. And as you can imagine, this is one of those benchmarks that does have a little bit of a delay, because by the time somebody knows they have COVID, they get sick enough to go to the hospital, and they end up getting sick enough to pass away from COVID. It takes a longer time. So it might lag behind our other data points. Any questions about the benchmarks?
Dr. Buchanan, I'm going to do my my kind of weekly. Can we go back to 2 and 3, please? This will be a little, I think I'll be quicker this week.
Yes.
But something caught my eye on actually more the testing volume. And I understand that it's not that this is all the testing. It's a representative sample, and it kind of which way the wind is blowing. And I also understand that asterisk indicates that that data may not be complete, but boy, it looks like our testing volume is going down. And maybe it's too early to say that, but obviously there's going to be tension between testing volume and turnaround time. If you send fewer tests, then you have the potential that those tests that do get processed will come back quicker based on the testing infrastructure. But I didn't know if you had an opinion about if, number one, is that really a decline in volume of tests? I don't know if they don't show up here until they've been resulted, or this is when they've simply been sent. But if that is a decline in testing, is that a good thing or a bad thing?
Well, I can answer part of your question. We only see them after they've been resulted. We don't have the capacity, capability to see them when they're gathered, except for the tests we're gathering. We are gathering, but it's based on results. So we get both negative and positive tests resulted back to public health, and that actually happens at the state level, a little bit at the local level, but primarily at the state level. Charity can speak to this better than I. She's been looking at this data and also looking at what we're seeing across the state and even across the country.
Yes, so that was last week's data for the most part. They aren't all in yet, but given the size of the numbers, the way that they look at that, the EPIs pull the data and look at standard deviations from change from day to day to day. And at this point, it's not flagging, it's not dramatic enough of a difference to flag. It's actually still showing in the positive with the percent change that we're seeing, or the standard deviation change that we're seeing every day. I will say that, and one of the reasons we wanted to talk about this week, that this is last week's data, is we are seeing a little bit of a downturn in volume of testing this week, we believe, and have asked the state about it. I mentioned it in our briefing today with our new cases and with volume. At this point, they don't really have a reason either. They've said they've seen it as well across the state. are asking the labs. There's not a physical like reporting problem or anything like that that's happening right now. So kind of looking into what it is, there's could be a myriad of reasons that testing's down a little bit. Whether it's good or bad, I think looking at where we stand with the percent positive, we don't really put a whole lot of weight on that because we don't have a good denominator, but you can still look at what that looks like. And that has leveled off a little bit, have been growing a lot. The rate of that is getting better. I think those are the things that we can really look at, but that one's still really questionable, Dr. Shamia. We went back and forth, but we've had 3 weeks now that we didn't have flags with our standard deviation, and we still kept it on yellow and decided to go ahead and make it red since it does seem to, green, since it does seem to be stabilizing, which is what the metric looks for in addition to improving.
Well, I think the other thing that you mentioned earlier today, Charity, was that if we look at our case rate increase and look at the trends in hospitalizations, those are, indicators of, as you've said before, hospitalizations are really an indicator of disease burden in the community, because those are real numbers. And if you get, whether you get tested beforehand, if you get, or not, if you get sick enough to go to the hospital, we're going to know you're a COVID case.
Right.
Yeah, and that's really they're trending together at this point.
Which
So
is
our
encouraging.
cases are downward trending a bit in the way that your hospitalizations are as well. So it is encouraging.
I think so. Thank you both. So the reason I asked that question is simply from a longer term control standpoint. We know we have to, at least as I understand it, we've got to, in a perfect world, we test a lot. We have a short turnaround time, and we have people quarantining as they're instructed to do, and we get that instruction to them out quickly. Each one of those ingredients are important. So we'll just kind of see. I think what I'm hearing is we'll see how that testing volume tracks with our other outcomes, basically.
Yes.
And Dr. Buchanan, I have a quick question for you.
Sure.
It's my understanding, and just correct me if I'm not on this. The tests that we are discussing and looking at now are strictly tests done by the health department. They do not include commercial labs, hospitals, testing for non-essential services prior to surgery. It's strictly the health department. Is that correct, or is this?
That's not correct.
Okay.
This is a sample of all testing for COVID-19 that's done in Knox County that is reported through the Department of Health at the state level. Unlike most reportable diseases, COVID-19, they want both negative and positive tests reported to public health. And as you know, that's a little bit different than the usual reportable disease process. So that's been some of the challenges with having good, clean data. Having a new process for reporting negatives has made that a little challenging for us.
Okay.
And then we did have a question earlier, and did you get an answer? Does this include, is this just PCR tests?
This is just PCR.
And this is just PCR tests, not any antigen or antibody tests.
Great. I appreciate that.
Sure.
And I had just one other question, this one on benchmark 3. And this is more of a kind of looking to the, I'm going to ask you to predict the future, which we all know we can't do, but anecdotally, as I've had acquaintances and whatnot, call me and try to figure out if this person who knew a person who had a positive COVID test, et cetera. I mean, it takes me easily 15 minutes or 20 minutes on the phone between figuring out the circumstance, determining what really happened there, and then trying to educate them about what's going on. I know that's not my job description, but when people reach out to me, but I think my question is so I think you've increased that 200, you had 206 folks last week. And it's a 2-part question. One is, what is the caseload of an individual person? And I know you're trying to redistribute people and get people back to doing some of their other functions. And the reason I ask that is that we've discussed previously about the collaboration, and we wrote the letter between the Board of Health and Knox County schools. And it's not just Knox County schools, it's really all schools that are going to depend on you. And there's been a few starts that have almost a few school starts that are ahead that have almost immediately revised plans because of trouble. trouble meaning positive cases and having to quarantine. And so I guess I'm really trying to get a sense of is just to what extent are those schools going to be depending on you guys, because I do think that's going to be an increased case volume, and to what extent that, you know, an individual, how much bandwidth do we have at this point to be able to do that work?
Yes, I will give that to Charity.
So to your first question, Dr. Shamiya, we typically plan 6 to 8 interviews per day per investigator or contact tracer because of just what you talked about. It takes a lot of time to get through the full investigation and do all the education, and have been able to maintain that with our team, and have they're reaching out to more than that. They don't get everybody the first call, that type of thing. But we make sure we have numbers of investigators and contact tracers to manage that type of volume. On to the school question, and Lisa can chime in as she was over here today for Knox County schools, and a very similar process will work for the University of Tennessee as well. They are going to be full partners with us in our contact tracing efforts. And so we will do the initial case investigation like we always do, and then work very closely with their teams. And they're each going to have teams at each and people at each school to be able to assist with contact tracing within the school itself, and helping with education for their staff members and students and family members and whatnot there. And then all of their information will come back into our system for monitoring and follow up appropriately as well. So in the same process, so essentially the schools, we have teams. So we have epi team leads every day and co-leads that are kind of running our teams every day. And the Knox County schools will become an epi team with their full team working together, and Lisa can chime in. And then University of Tennessee, with the size of them and what we expect the volume to be as well, will be a team as well, and we're actively working with them. Lisa, did I miss anything?
No, you didn't. I'll just say, Dr. Shamiya, we have our team set up, and so I have a co-lead with me, and then I have several other team members, and all of us have training on next Wednesday. How to use the database and things like that. So,
and they're getting the full contact investigation training. So even the front end side, so they have a full scope of understanding of what the process looks like and the questions and that type of thing.
And in the tiered system that our team members have developed really allows for a lot of support. So if you have somebody who's relatively new to walking somebody through contacts and contact investigations and stuff like that, they have somebody who's a more senior person who's been doing it for a while who can help them with those questions. So there's a lot of hand holding that happens at the beginning, and then as people get more comfortable, then they're helping somebody else learn as well. So the idea is honestly that we'll have almost 100% of our staff trained to do some piece of our response, so they can get pulled in when needed. And then go back to their regular job when we don't need them anymore because case counts have gone down, or we got some more staff on board. So Charity and her team have a really good plan in place, and so and which has been tweaked several times.
Nearly every day.
Yep. So thank you. And remind me, when is the Knox County school start? I know it got shifted, but what's the start date?
24th of August.
Oh, yes.
Okay. Thank you very much.
Dr. Buchanan,
Yes,
I had a couple contracts come across my desk last week for third parties with public health capacity. Can you please tell everybody what's going on with those?
Sure. So one of the things that we'll be doing with that, we hope to be doing with the $7.1 million we got from the state, which came from the CDC, is to hire folks to specifically do contact tracing and those pieces and case investigations to allow our staff to have some more capacity, and again go back to some of the regular jobs, and for some folks even back to a little more regular schedule. All of the staff we're bringing on will be expected, like our staff, to be available 7 days a week and expect to work some weekends because we don't stop doing this over the weekend. In addition to that, we hope to be able to also hire some more support staff for testing so that we can, well, we're back to school. I think we'll probably have to reduce our testing, but we'll still need to do flu vaccines and other things. So we're backing up our clinical staff and our testing staff so that we can expand that as well. So that's, in addition to that, we'll be also adding folks to our joint information center and our phone bank through that. So that's what we'll be doing with all those contracts. Any other questions? He's Dr. Gocher, I believe you need to unmute.
You're right. Thank you. Anyway, Dr. Buchanan, what I was saying was that I appreciate your really good report. And if there are no other questions or discussion on that report, that we can move to the next item, which is the University of Tennessee Medical Center's report from Dr. Shemaya. Before, is there any other discussion on the benchmark presentation from anyone? Okay. So Dr. Shemaya, we'll turn it over to you for the next item, which is the UT Medical Center's update. Thank you.
Thank you. And so we can just turn that to presentation mode. Okay, so same format. Actually, very little change today from what we've gotten used to. So let's go ahead and next slide, please. So this is, again, this is the slide that is UT Medical Center data. And it really hasn't changed. The positive test or group that we have sent is on the left by age, by decade of age. And then our hospitalizations are on the right. The younger trend to positive cases, and then the somewhat older trend to those that end up hospitalized remains, although again, still significant patients in their 20s, 30s, and 40s being hospitalized. The other just kind of comment, a sneak preview, is that thanks to work at the Tennessee State Data Center at UT, we may be very close to getting this type of age demographic data, not just for UT Medical Center, but for across the community. So I don't know what week that will be, but if ever I have that instead of just our hospital data, then I'll bring that. Next slide, please. So this is what we show every time, and just a few comments about that. First of all, on the left is Knox County, and on the right is the THA Knoxville district, and we've pulled the definition of that district onto every slide. On one hand, the actual number, the relationship between the number of new cases, 1,000 new cases, and then the hospitalizations it generates is staying about the same. It's slowly dropping a bit, but I'm trying to not get into the statistical weeds too much here, but the quality of the correlation is not quite as strong. And so even though I've still got a straight line drawn through that, you see the degree to which those round circles kind of go up and down. And you also kind of get a sense that it's starting to flatten as opposed to just keep going straight up in the upper right-hand side. And so this may mean that if the volume of testing we're doing, this is part of why I ask about is testing actually lower? I mean, if we are testing more minimally symptomatic or asymptomatic patients, we would potentially expect to see the strength of the correlation between the number of diagnosed cases and how many hospitalizations they generate weaken to some extent. But regardless, I'll keep updating you about this, both about the numerical relationship, but also the strength of correlation, because if the correlation isn't strong enough, it may not be worth really looking at this. Next slide, please. So this simply shows the pace of new cases. And so I do want to point out a few specific things. And on the left in Knox County, you'll see that we went from 113 days to get to the first 1,000, then 15 days to the next 1,000, 9 days for the next, 8 days for the next. And so, but at least it did go from 9 to 8. And so what we want to see is that number to start getting, we want it to take longer to get to the next 1,000. We want it to be 50 or 70 days to get to the next 1,000, but at least it's not 3 days to get to that next 1,000. So that 9 went just to 8. On the Knoxville district, you see we're picking up another 1,000 cases about every 3 days. Next slide, please. So this shows the new cases by week and month. And I think the point I'll show here is that usually I draw your attention to the right-hand side. Let's stay on the left-hand side. And if you just look at Knox County, week to week, 605, and then 763 cases, then 889. We want what we're really shooting for here is a decline in week to week growth. And to me, from a healthcare infrastructure, it ends up being about hospitalizations, but from just a disruption of society standpoint, it really ends up being about cases, because I do think that the general public is starting to, businesses, everybody is getting a sense of what that positive test means in terms of quarantine, and what being a contact means in terms of quarantine. And what we said last time, and I'll say it again, because I think it's an important education point, you can't test your way out of a quarantine if you're truly a contact. And so there's disruption represented here, but we really want to start seeing that jump from 763 to 889. We want to see it only jump to 910. And then the next time it actually goes down. That's what we're shooting for. Next slide, please. So I showed this last week, and I'm happy to show it again. And so this has to do with really the date at which the mask mandate, the mask ordinance resolution started, and then what is happening to our doubling day rate. And I'll repeat the analogy I gave last time, is that if we're in a car and our foot was completely down on the accelerator, we were going 60 miles an hour, 80 miles an hour, 100 miles an hour. What I said last week as this started to flatten was that we were still going 100 miles an hour, but we had our foot off of the accelerator. And as that starts to curve down just a little bit, that really means that our doubling day rate, or our growth rate, is starting to slow down. And so if this can be maintained, then that slide I showed you before, where I said we want to start seeing new cases evolve slower, we would expect to see that. But we also want to see this curve all the way back down to really where it started. But I guess my point is that I can't say definitively that mask or even the action that we took did this, but I can say something did this, because it does seem that our doubling day rate is slowing down, and that's the first step to starting to get this under control. The map on the right, it simply shows that Hamlin County, which I believe had enough cases that I believe they were running into issues with schools, or I'm not sure exactly what, but they've very recently, too early to see an effect, added a mask requirement. Next slide. So this just kind of contrasts us to other parts of the state in terms of essentially the growth rate. And so Shelby has kind of been a little bit of a stutter. Davidson has convincingly started to turn down to a slower rate of new cases. Hamilton seems to have peaked and is inflected. We're still in Knox on the way up in that regard. But again, as I've shown, is that the hope is that there may be some momentum that we're at least in the very beginning of picking up, but we can't. I mean, what I would caution is that whatever it is that's done that, if we undo it, we'll be right back. And it's too early to say. I mean, what I really care about is not that. Could you go back to the, I think it's just one slide. As much as I like to see this, and please go back one more slide, what I really want to see is this start to go down. To me, that's getting the pandemic under control. And then please forward to hospitalizations, next slide. And so this was, I need to stop here for a second. So there is a difference between this and what we're about to look at. This is simply new hospitalizations. The other thing I show you, and I'm about to show you, is hospital census. So these are new people that end up in the hospital. Hospital census across the district is the number of people who are in the hospital at any one time. What you see here in Knox is a big spike. So 25 to 45, which catches attention. We are getting somewhat of a sense, the folks who help me with data, that these hospitalizations are assigned by the state based on contact investigation. And we're getting a sense there may be a little bit of a lag here. And so I'll be very interested to see this over the next 1 to 2 weeks, because I don't know if that 25 to 45 is really what happened, or that represents data that's just a little bit older data at this point. And the reason I say that, if you could hit the next slide, please, is that, so this is our inpatient census across the district. And again, this is every day. Occasionally we have hospitals that don't report, but these are the number of patients that are in the hospital in any given day. And, you know, I would say that, I mean, this is definitely what we want to see. We've had ups and downs, but that 185 to 160 represents about I'd call it about a 7-day consistent stretch of decline. And so that's more consistent than what we've seen before. And so next slide, please. What that leads to, and again, this isn't really fancy math, but it just takes what we've seen, and it's very sensitive to a change like that. And so basically what's happened from July 28th to August 3rd is enough to really influence that trend line. And this was part of the reason why, when I said I think we need to look at data once a week, it's changes like this. Now again, this is everything else I show you each week is what's really happening. It's taking real data that's really happened and then just showing it. This is the only thing we show that is a projection into the future. And so it is inherently, I mean, it is what it is. It's going to be somewhat less reliable. But I think the point of this is it doesn't take a lot of progress to start to show that on September 9th, you know, I've been showing you numbers of 360, 370, 380, which is a number I do not like to look at as far as hospital census. And this shows that there is, but it's just 1 week. I need to caution us, it is just 1 week. And I actually know that there was in our daily capacity call, we had a bump today. And so we'll have to see how that plays out. And then the final slide, please. So this just shows you what I've been, this really drives home the point that for 3 weeks we were projecting, for 2 weeks we even projected the same exact number, and all it took was it to inflect down like that, and then we've got a significantly different projection. So we're just going to have to see where this goes. So with that, it ends the slides. I'll be happy to answer any questions.
Dr. Shmay, I have a question. I guess it's maybe the 4th slide about hospitalization correlation.
Yes, sir.
So you have a straight line fit to that curve. Do your data analysis folks use other curve fits to that? Or in other words, there are sometimes curve fits that will curve downward. It kind of looks like it would be curving to the right, just looking at either one of them at Knoxville district, maybe.
So,
and that would imply maybe that you have more cases, but relatively fewer people are being hospitalized. Could you comment on that? It may be
so to the best of my ability, and I'll also bring you a more definitive answer next week once I am able to ask the folks who kind of prepare and do all of this. So first of all, it's been very, it's been portrayed as linear, because as they decide what best fits it, it's been aligned. But I think your point is spot on, at least part. I'll say for the first part, and then I'll add the second. Is yes, as that flattens, as it comes around, that would suggest that we're not hospitalizing as many people for however many, for each 1,000 that we find or that we diagnose of cases. But it also means that, as the correlation weakens, our ability to predict that going forward may become less. And so, but I think what I'll ask and have a better answer for you about, try a lot of different types of ways to fit this data. And is it linear one week, but maybe it's not linear the next week? I'll ask that question and have a better answer for you next week.
I appreciate that. Thank you.
Yep.
Any other discussion on the UT data update? Questions? If not, Dr. Shemaya, as usual, thank you for a very thorough presentation.
Thank you.
Very nicely done. Next on the agenda is the review of the COVID-19 face covering regulation, which is regulation 2020-1. Dr. Buchanan, are you the one I go to for the discussion, or do we have a general discussion on this?
You certainly can come to me. I know we decided as a group we would look at this every week. And I guess one question for the group is that useful? We continue to, for the city and the county both, education is our primary tool in getting and helping businesses and citizens comply with this mandate. No one is issuing citations. I don't believe there's a plan to issue citations regarding face coverings. So if it's still useful to review it, we can, but if it's not useful, we could leave it at, come back if there's a problem, if there's a concern, if there's something that we need to change. And so that's just a question for the board. How useful is it to review this every week?
I know that we all are in receipt of a lot of electronic communication on this from citizens of Knox County, which is greatly appreciated. And the information is in a way all over the place. There's some people just really very happy that this is being done, want us to do more. Other people, for various reasons, do not. But it just occurs to me, and this is a very random sample, just being out in the community, that there's a culture change that is, I think, starting to take place, which is very gratifying. And that is that by whatever reason, there are more and more people that you see out with masks. And I would invite other members of the board to tell me if I'm right or wrong on that.
I mean, definitely, I am seeing more masks being worn anecdotally when I'm out doing the things that I'm out in the community doing, but which is encouraging. I'm really thrilled about that. But I guess as far as a report, it would be helpful to know what you want to know and if it's useful for me to bring information on a weekly basis.
Discussion from the board as to what we might want to have in terms of an update on that. Any thoughts?
So I originally requested that update just because I think that it had been in place for maybe 2 or 3 weeks. I don't know that I personally need it every week, but I guess as things go forward, if fingers crossed our numbers are good, I don't know that we necessarily need, or at least I don't personally need an update on how many people have been educated and things like that. But I think it's just kind of helpful for us to at least know what was being done to make sure that we were doing the right thing.
Dr. Sousa, if it's okay, we could keep it on our future agenda just to have a brief invitation for any discussion that comes up, because it's hard to predict the future with this one.
Yeah, no, I agree. And I guess my comment was that I don't necessarily feel the need to have Mr. Neese come every week or anything like that. If we see a problem perhaps, but I think having it on there just for us to make sure that we're still, staying on the course is reasonable.
Sure.
Any other questions or discussions about Regulation 2020-1?
I just like to give a word of encouragement in that we are starting to see, and again, I try to really focus on the data, but at least the time association between when masks were more emphasized and what we're starting to see in the growth rate. I would be more anxious than I am as we go into school starting and as we go into UT opening, if we weren't starting to see that kind of slow down, that growth rate, which then affects the case diagnosis rate. Everything lags in COVID. We figured that out. It's one action and the next one has a lag and the next one has a lag. But I really, in my heart, sense that it's doing something. And I think the data is showing that is supporting that. Now the question will be, when you start to add new things in the environment that are changes, then it has to restabilize. But I just want to give encouragement that I think, just to keep it up.
I want to echo that. I think I see it. I see it consistently around the county and in the city. And just to let our citizens know that, we're watching this. We want to make sure we get to a point where we can drop this at some point in the future. This is not going to be something that will be forever, and that we just need to have that discussion. This gives us a point of time just to say, hey, how things are doing, and I think we're doing better.
Okay.
I just want to say one thing. That pharmacists have been reporting to me that they're seeing a lot more masks come in to the pharmacies, and they're keeping them on, and they're social distancing. And so I think it's a good thing that we keep it for a while.
Any other discussions? If not, we'll thank everybody for that report. And next on the agenda is COVID-19, item 10, which is COVID-19 suppression at bars regulation 2020-3 review with a proposed amendment 1 to that regulation about timing of bar closures or difference. And so does everyone have the updated information, or have they had an opportunity to review that? I'll start with that question.
Yeah, I think we all have, at least I have the updated information.
Okay. So we're looking at a proposed amendment to that regulation, and I believe Dr. O'Brien, you were the author or the one that's bringing this forth. Is that correct?
Yes, sir. I'm bringing this up because in looking at the data that we've had coming in and talking with staff at the health department, we have been thankfully not finding clusters of cases that relate to bars and restaurants in our community. We know we want to do as much as we can without putting an undue burden on our community and still make a difference. Given that our data has not shown that to be a problem, and we've had some impassioned emails, I've had phone calls, we heard from the public forum. What I was proposing to add just an addition to that order, and that would change it from a closure to a curfew. And I would like your consideration of that based on what Charity Menifee has reported as staff, that we have not had defined clusters with this group. And looking at the economic, adding the verbiage I put there, which is, basically that they close, but at 10 p.m. Eastern Daylight Time daily. And I don't know if it needs to be that specific to say Eastern Daylight Time or local time. And then I would like us to make sure that we review that order on a very regular basis, and we talk about it, if not weekly, or put an end time on it where we would have to re-vote it in. But I would like your consideration. I know that there's a lot of people that are concerned about their livelihoods, and I have that too for them. And I still want to balance out what we're trying to do for the community. Is this the right fix at this time? Is this the right thing for us to kind of shut down or to close down someone? So I just want to bring that to everybody's attention and see what people think.
Dr. O'Brien, do you want us to screen share that amended version?
Please, if you could show that, yes, that one, it's in those two sections. I think if I remember correctly, I don't have it up on my screen right now, but I believe it's 4 and maybe 11.
Catherine's going to pull it up for us. And this one, we did put a time limit on it. It expires August 20th. And
That's right, I forgot.
it has to be renewed by us.
That's
So
right.
we're gonna keep it in place.
So Dr. O'Brien, would you formally like to offer this as a motion for the amendment to 2020-3?
I would like to offer an amendment that in section 4, and I believe again in section, show it down there, I think it's section 11. Yes, that we add after 10 p.m. Eastern Daylight Time daily to the order. And the intent is to change it from a pure closure order to a curfew order for these businesses and for, I don't know if that would change things. We'd have to ask Mr. Sanders, our attorney. I would ask that once, if this is voted, this amendment to the order is voted in, that this becomes effective at our order.
So we have a motion for the amendment to 2020-3. Do I have a second?
Second.
So we have a motion and a second, and let's have a roll call vote on this. So Narda, if you'll go through the roll on this motion for an amendment, please.
So is there an opportunity for discussion?
Yes, after we, well, we can discuss, yeah, we.
Maybe I'm not understanding the process, so you can educate me.
The discussion would be whether we offer we should have discussion, I'm sorry. The discussion should be at this point directed at the amendment to be included for a discussion. And Mr. Sanders, you help me with this a little. If we do this, will this alter 2020-3 to the point that we need to re-vote on 2020-3? Or does the amendment itself pretty much do the revisions that we're discussing?
Apologize, I got mute there.
Right.
I believe the ultimate amendment that you're going to vote on will accomplish what you need to do. You don't need to re-vote on something that no longer exists. So you will essentially be amending what already is, and the amendment will take care of enacting the new regulation. Now, as far as I'm understanding, right now you're discussing whether to amend.
That's right.
Whether to off. Are you discussing an amendment to the amendment essentially, or are you just simply discussing the ultimate proposal that Dr. O'Brien has made?
So Dr. O'Brien has offered the following on the screen is an amendment to 2020-3, and we have a second, and we really should have a discussion of that, which by your discussion is going to result in alteration of 2020-3 to basically what the amendment is. So we're essentially substituting the amended 2020-3 for the original 2020-3.
Well, actually, no, I'm sorry, I didn't quite understand what the question was. What I would suggest is simply offering this as a new regulation in place of 2020-3, and it would be 2020- whatever the new regulation next one is.
Any discussion on Mr. Sanders' comment? And if, Dr. O'Brien, if you view that, I think that's a reasonable way to proceed.
Yeah, I think
prerogative. But if you would craft your amendment such and get a second on, we'll discuss it.
Okay, if that's what Mr. Sanders wants, what I would do is that we.
Mr. Chair, Dr. Bryan, excuse me, Mr. Chair, perhaps the best thing to do is for us all to avoid the word amendment unless someone's amending Dr. O'Brien's motion. As he's moving for a new regulation to be substituted for the one that is already in place. And if we keep speaking of it as an amendment, we're going to get totally confused here.
I agree.
Sorry to interrupt.
Okay, and I didn't realize that we had to do it that way where we're putting up a new public health regulation. So if that's the case, what I would ask is that we review this public health regulation, which in effect is an amendment of 2020-3 to be the next numbered regulation, if so voted. And I would like to see if we can get a second for that, please.
So we have a motion on the floor, and if we are numbering these regulations, Dr. O'Brien, it would be because we have definitely postponed 2020-4. We could call this one 2020-4 and renumber the other one if that's acceptable to everyone. So we can keep things in the proper order.
I'll second the motion.
So we have a motion and a second. So we're open for discussion now.
So, Dr. O'Brien, I will, first of all, I'm very receptive to having this conversation. I mean, it's our responsibility to be thoughtful and deliberate in the decisions that we make. I do have a few questions, and they're not any one theme. They're really very different things. But one is, I just, from a timing perspective, I want to understand that, I mean, I think that it goes without saying that just based on the fact that this was something that was in its current form passed 7 days ago, went into effect just a few days ago, and I think the discussion, and I want to get to next, I want to get to that point that you made about our local data. I do want to dig into that, but I think my first question is simply that, just to be clear, we're not proposing this. I mean, even the data I showed today wasn't significantly materially different than the data I showed last week. So this isn't in response to something in the COVID environment. This is in response to just having had the opportunity to rethink it, or because in a COVID environment, this would be too quick to change a decision that the board has made, because we will not have had any ability to see the effect of the decision in real life.
Yes, this is exactly that. My thought process from last week to this week changed based on, discussions with, the staff, with looking at our data and trying to decide really, and stepping back and saying, was this the right move to make as the one thing to layer on top of our mask regulation? I think the mask regulation is doing a good job. On rethinking, I thought that this may not be the best specific way to try to help the process of mitigating the virus. And so I looked at it as a way to do one thing where we were concerned about gatherings, concerned about late evening gatherings, concerned about what may happen once college is back in play here, and trying to look forward that way, and taking this regulation off the table as currently written and switch it out for something that may be, I think, potentially more beneficial to this community based on where we are today.
Okay, so thank you. And so I have I think a follow-up question. I think that there is something that, and this is more for our broader based decision making than it applies just to this resolution. So I want to make this point is that there's something you said that, and we talked about this last week, that our local data had not really pointed to bars as a local outbreak. And I do want to though make the point that I think, generally speaking, we had a resolution where we endorsed a unanimous resolution where we essentially, it was non-controversial, we endorsed those 5 core actions. It was the education resolution. And so a lot of any action, this is the way I view it, is that any actions that we might consider going forward really relate to what is the likelihood in a circumstance that those 5 core actions may not be followed. And so to me, that's how I frame our conversations and our approach in data, trying to make data-driven decisions, and I frame it in those 5 core actions. And so to me, regardless of, I guess my point I'm trying to make, and you know, this, it pertains here, but it's going to pertain again, is that if as particular, I mean, we don't have all the data that we would like to have in this environment I mean, this is a rapidly evolving scientific situation, but we do understand the basics of how COVID-19 is spread. And so I don't want us to get in a position where, I mean, it is very reasonably likely, given the difficulty with mask wearing, the difficulty in social distancing. I'm not saying it can't be done, but there is that certainly possibility, and we know we've seen it in other communities. So irrespective of how this discussion and vote goes, I don't want to set that precedent that we can't just use rational logic about how COVID-19 spreads to make decisions, because we may not always have the level of local data that we'd like to have to make decisions. Does that make sense, sir?
It does. And, you know, this is one of those things, just thinking through the last week, questions I've had about, you know, somebody going to some organization that meets our criteria of a bar, the greater than 50% alcohol sales, versus somebody going to one of our restaurants that basically is at maybe 49% and has essentially the same thing, and they're still open. In either case, staff has not found direct issues with this, and we may have to change something going forward if things get significantly worse in our community. But I would like us to just basically take a step back, allow our business partners in the community to do the 5 core actions, and to, though, add one thing, which is to let's kind of close down the sale of alcohol at those sorts of places at 10 p.m. and to see if that one thing may be something that we can watch as one layer on top of our foundation of masks, of social distancing, washing hands, staying home when sick, those sorts of things are our 5 core actions.
So if I may, I have a comment about our previous resolution or regulation and you know, possibly why we need to adjust it. And it's really a matter of fairness, and it has to do with just all of these legalities of what defines a restaurant, what defines a microbrewery, what defines a bar. And it seems to me that and I'll use the example of microbrewery, but there are other businesses where this will come into play. In a microbrewery, somebody has invested a lot of time and effort and money, and probably are working on a very thin margin, and they just cannot afford to have the infrastructure to have a full service restaurant. They often rely on food trucks or caterers, and they may in fact be approaching 50%. They may not, but they may be approaching 50% of the total income of that entity being food. However, it's not on their books because it goes to another company's books. And if you just look at it from that common sense standpoint, it's inherently unfair. And it's, again, kind of using a blunt approach rather than a surgical approach, where you look at what the problem actually is and how you can craft a way to mitigate that problem. The problem is lack of social distancing. The problem is lack of mask wearing in just a kind of a free-for-all environment. And we all would agree that is something that should be controlled if it were to get out of hand. But and we've heard from some of the folks in the public forum really just that information. So that would be my plea, is that the way the rules or the regulations are for the different venues that serve alcoholic beverages, in a way kind of ties our hands if we try to say, well, 50%, you're going to fit in this category, over 50% that category. It makes it difficult to do this fairly. So I guess that's something that's really concerned me this last week, especially.
If I may, I would like to just remind us as a group that we considered this proposal last week, really with the very best of intentions, with the information we had on hand based on the White House task force recommendations, Dr. Burke's recommendations, and also in anticipation of the one variable that is huge that we can't define with confidence yet. But again, common sense and logic would tell us the variable is when schools reopen, public schools, UT, which is 30,000 students, we know that's a big variable that can really impact the spread of the virus. And so this regulation was developed with the intent to anticipate, because we can't, when we know this about viruses and illness in general, we can't base all of our decisions. I think Dr. Shamia, you were addressing this a minute ago. We can't base all of our decision on real-time data. We're always a step behind anticipating the way that the virus is going to act and impact us all. And I would like to go on record once again to point out to the public that all of us have made at one point or another recognized that we realize the decisions we're making impact people. And we don't take this decision or our responsibilities that are attached to us lightly. So I just want to remind us where this all came from. It's in terms of fair or not fair. We really, I guess, best faith is we have acted on best faith and the best information we have available.
I'll just say one thing. You're right, Dr. Hurt. We are living week to week with new information coming in, where we have to evaluate what's going on not only in our community but our state and our nation. We have to look at studies. We have to look at how our testing is, multiple variables, and we do that in the face of being volunteers who have come together to try to help our community. So we will make decisions that will change potentially week to week based on what we find out and what we need to do. We sincerely hope when UT gets back in session and Rome State and Pellissippi State that most of those students shouldn't be drinking alcohol anyway, shouldn't be congregating drinking alcohol, but we would be crazy not to think that that may happen. But it will probably happen more in private environments than in public environments in many cases. So again, I think we need to look to that and how to watch for that and mitigate, and we will have to contact trace those cases as they come up. But at this point today, with these businesses, I think we would either need to revisit all the specifics of who this would cover and and add some things, or again, I offer something as a simpler solution, and that's just to go to a curfew at this time. And then we'll evaluate again. We'll see where we need to go. We'll see if we need to do what I was going to propose earlier, something about 25 and under in small spaces. All that is on the table, and any of us can bring that based on what we're seeing. So again, I just ask your consideration for this change tonight.
So a question about, at the end of the day, this is about achieving results. It's whatever's most, if you think about those 5 core actions, and if you really focus on the mask wearing and the social distancing, and you go with the premise, which maybe not everyone agrees, that a bar is inherently more difficult place to achieve those things. I guess my question, and this may be partially for Dr. Buchanan, is that obviously we know there have been kind of the enforcement piece of this was something we discussed a week ago that of what was passed. And that's something that obviously is going to continue to have discussion. We had members of the public who run some of these establishments who talked about, again, that was a subset, that was a small slice, but they talked about how diligently they're following these rules. I don't know that everybody is doing this. I just know that this type of business from a COVID-19 perspective has inherent risk. And so my question is, whether it be some reporting mechanism, I would be more comfortable with this if I had confidence number one, it was going to happen. And you guys are, some people are teaching me, I've had a civics lesson throughout this whole process. This is not something that has been, that I've been learning as I go, but I'd feel more confident if I thought it was really going to take place. So I don't, that's really more, I guess, open discussion, but I do think it's worth talking about.
So it may be possible to make progress, and we've heard both by email and this evening that there are business owners that are trying very hard to be responsible. Now, whether they are succeeding or not, I certainly hope they are. But if they're driving at least their part in enforcing those 5 core points, then I think they're doing their part, and maybe their businesses are safer than those who don't.
So this is just from our staff and from the regulatory side of the house. The majority of restaurants and bars in Knox County are following the guidelines, having people wear masks except when they're seated. And so the majority are following the guidelines. So I would say, if we decide to say it's more of a curfew issue, I think from the business side, that's a little more palatable than saying we're just going to shut you down, because they have worked hard to be compliant, and they have worked hard to change their business model and to stay afloat, and had some challenges. So again, we're back to balancing that, the economic viability of our community and some small businesses, and the health of the community as well. Those are two things that aren't mutually exclusive, but we're tasked with balancing, because public health is not just whether people are healthy or not. It's physical health, it's economic health, it's emotional health, it's all of those things that impact our lives. And so to make this amendment might actually increase compliance, because it's a lot less harsh than we're just going to shut you down. And so just coming at it, if I'm a business person, and we make this amendment, it demonstrates that we are thoughtful. We might still have to come back and say, hey, that didn't work, and look what happened. If you look at Nashville, what they saw was they had a big hotspot on Broadway. And that's one of the reasons they made their decision to shut down bars, because that's what's on Broadway in Nashville, a bunch of bars. And so they made that decision based on their data. Now we do have a growth rate in our 21 to 30-year-olds of over 300% last week. So that was significant, and have had about 800 cases since the 1st of July in that age group alone. So it is a growth rate. But again, when we talk to these folks, people are going out to bars, but we're mostly seeing people gather socially outside establishments. And that's where we're seeing those gatherings happen. So, if we really want to use data, we can look at Arizona as an example. I think they've seen some changes since they closed their bars. But again, I think in a first step to maybe consider the business side of things, this amendment seems reasonable. And I don't know if it's storming outside, but our lights are kind of going off and on.
It is storming.
Okay. So we might lose each other. But those are just my thoughts when it come at it from our regulatory side and from the data side, kind of compromising, I think, to kind of offer the business owners a little bit of relief. It's still not going to be easy, but I think we'll probably get better compliance with this amendment than we will with the order as written.
I would like to offer a friendly amendment for us to consider, and this is based on a lot of the feedback we've received in the past week from people who have been affected by this most recent regulation, saying, well, and we heard it this evening as well in the public forum, people saying, well, what about restaurants who are serving alcohol after 10 o'clock? I mean, how is that fair that bars have to have a curfew and restaurants don't? So I would like to propose a friendly amendment that says on-site consumption of alcohol curfew 10 p.m. for everybody across the board. Anyone who sells alcohol, a curfew at 10 o'clock. What are y'all's thoughts about that?
Can we ask Mr. Sanders legal options?
Can we get a second?
If we could speak to the spirit of this regulation, it was, and we have to realize all of this is somewhat arbitrary, but it was so that people were not congregating at a bar drunk, which is more likely to happen later at night. Not so much that people couldn't go out and have a few drinks or do whatever. And so I'm supportive of Dr. O'Brien's amendment because I think it achieves that. But I think that if you also just across the board stop alcohol sales at 10 p.m., you'll end up shooting yourself in the foot.
How so? With all due respect, Mr. Mayor.
Again,
because we've all read lots of email from bar owners. I mean, I printed them out, hundreds, not only from people other than bar owners, but bar owners saying this isn't fair to pick on us. Yes, we serve alcohol. Yes, people can get drunk, etc. But what about the people who can go to a restaurant and continue to drink and get boisterous and get in each other's? In other words, we can be less assured that the 5 core actions are being preserved in a different environment due to alcohol. That's all I'm asking on behalf of those bar owners who very poignantly made their case.
I think we have to take human nature into account here, and people are going to find a way to do what they're going to do. So, we can only do so much. And otherwise, you're going to force it underground. And as Dr. O'Brien said, people are going to find a way to do this. So at least in a restaurant, it's a more controlled environment. And I thought that was the idea behind this regulation to begin with.
What we know is that what we can feel confident about is that the longer people continue to drink, or people who choose to begin drinking later at night, are going to be less inclined to observe those 5 core actions. And in response to last week, you made a great analogy about squeezing the Jell-O, and then there's always going to be some underground activity. That's true. I agree. That's human nature. But by that same argument, we as practitioners then should not have any regulation on for whom we write prescriptions for opioids, for example. We know that restrictions are a necessary means to help people stay healthy. We know there are going to be people who will find another avenue to harm themselves, put themselves in harm's way. But I don't think that excuses us from our responsibility to do what we can to limit that opportunity. I'm curious to know what the rest of you all think about this amendment and your understanding of the feedback that we've received from bar owners and many people in the community, which I really appreciate.
Well, I would like to get a second on the amendment if we can, and then we can formally discuss it if there's a second. If there is not, we can consider that as just a point of discussion for the larger regulation. So we're continuing to discuss the larger regulation. Is that what I'm understanding?
I believe so.
Okay, so let's continue to discuss the larger regulation, which would be bars, I guess, for lack of a better term, but establishments that primarily serve alcoholic beverages as having a 10 p.m. curfew, but remaining open, but certainly either encouraging or requiring proper social distancing and masks.
So this is really a question directed at, I think, Dr. O'Brien and Dr. Buchanan. So I guess what I think you're both saying, and I just want to kind of confirm this, and I know you're just speaking out of your best, the best idea that you have, but that because this would allow people to remain, again, it's about results for me. It's about what is going to be effective. And so this will make it, and I agree with Mayor Jacobs about the kind of the spirit of the intent of this. The idea is that because people will have been able to remain open, that we feel confident that the level of compliance at 10 p.m. will be high, and that I don't know how we get a report of that or feedback on that, but in the event that it wasn't, and alongside in parallel, our COVID numbers continue to, we can't get these cases down, then we'd have no choice but to revisit this issue. But I think what you're saying, I'm not trying to put words in your mouth, is that you have confidence that this would be potentially in the end more effective because it would deliver the desired outcome, or do we really not have that sense? And I'm not just talking about microbreweries, I'm talking about everybody.
All I can say, Dr. Shami, is, this is a start. Yes, there are certain restaurants that do stay open after 10 that do serve alcohol in our community. We can always look at that if we had issues, but I think taking what we have right now on the table that was already passed, making this simple amendment and going to the curfew for that group, I think most of those business owners are willing to give that a try. It will be something that we should keep looking at and evaluating on a regular basis, as we are doing every week right now, and seeing if, something needs to change. But, I just feel that we need to give a little on this one thing until we have something that points us in the direction that this was not the right decision, and that the economics of it at this point, I feel, outweigh the reality of active spread, and that hopefully we have some really good business owners in our community that will do the right thing. We do have some business owners that don't. And as we get more information, I think we need to be more surgical in dealing with those. And I'm glad we have Mr. Sanders on board to assist us in looking at issues that may come to us to consider. And as the epidemiology progresses and we see where we're going, then we can make more decisions that, again, may be more surgical. But I wish we could do something that was across the board, but I think tonight, I would like just to do one thing to put the curfew in based on the current order and give that a try at this point.
Just one quick point. Mr. Sanders is still on the line with us, but his battery is starting to go on his laptop. So he is not on video, but he's still here with us.
And as far as compliance, Dr. Shamiya, have to talk to my staff. We certainly do different things to ensure compliance with people that operate later in the evening and aren't even open when we're regularly at work. So I'm sure we can come up with some way to spot check compliance.
Other discussion on the regulation 2020-4? If not, are we ready to vote? If so, Narda, if you will go through the roll call for this one, and thank you for doing that.
All righty. Dianna Drake,
No.
Gotcher, Dr. Gotcher,
Yes.
Hurt,
Yes.
Jacobs,
Yes.
O'Brien,
Yes.
Shamia,
Yes.
Sousa,
Yes.
Wagner.
Yes.
We have 7 yes and 1 no. Thank you.
Dr. Goetsch, still muted.
Oh, sorry about that. We have postponed definitely regulation, which will be renumbered 2020-5 for 1 week. So we're at item number 12, which is other business. So is there other business to come before us this evening?
There's one question that we do need to answer and then talk about switching up how we manage that. So if the board wishes to continue to have public forum available at our meetings, we have to make that decision to do that. And then I'm looking at Catherine because we talked earlier today about having a way to do that doesn't involve so much of Mayor Jacobs' staff time. Because we're grateful for Mayor Jacobs to do that, but it was a lot of staff time. If we can streamline, and I'm sure we can streamline the process to make it a little easier.
And I think from our perspective too, we're meeting every week and most boards meet monthly. So I think that maybe if we could have some sort of scheduled public forum not every week, but once a month or so, I think that would be beneficial.
I would agree with once a month, given that other boards, commissions do that. I would say if we could do it once a month for 30 minutes, that would be great.
And it's not like we're not hearing from the public. And the other thing that my staff is looking at for the board to be able to do is to have something like County Commission has a forum where commissioners can it's kind of like a discussion board for commissioners. The public can see it. And so you can actually bring things up there. We'd have to follow the appropriate rules, but we're looking at setting something like that up as well. And so the other thing I'd like to remind everybody is we're really using your Knox County email addresses to communicate with you. And I realize that's a shift for everybody, but it's really the only way we can keep all the multitude of emails from going to your other work emails. So please look there on a regular basis. We'll be communicating with that email address with you. So I know that's a shift, but it's having one email address to use is just helpful.
Can I just say something about that? It seems that different groups have put out email addresses for us on social media. Excuse me, phone ringing. And I found out I have a City of Knoxville address because I'm the fire department medical director. I have never used that email. I opened it up, there were 925 emails there. So somebody put that out that I have that email address, which I didn't even know about until I was told and looked, and it was pretty full. So please, to the public, if you want to get hold of us, use our knoxcounty.org email addresses, and we're happy to look there. But The city of Knoxville would appreciate, in my case, that you don't inundate that mailbox. Thank you.
And there's also a common mailbox, health@knoxcounty.org, health@knoxcounty.org. So please use that one.
No, I'm sorry. There is actually a common email. Is there a common email for the board?
Right, so
That's
on
separate.
the Board of Health webpage,
Mhm.
on COVID.Knox County.
On the Board of Health webpage is a common email. That the email you just gave out is for general health department inquiries, not specific for the Board of Health.
Sorry, Dr. B.
That's okay. It just, we end up having to forward it to everybody. So they get it. It's just a different way.
What is the Board of Health common email? Do you know that one?
There is a, this is Catherine, everybody. There is on the Board of Health webpage, on our series of web pages, there is a form at the bottom of that webpage where anyone can fill that out, and that will be sent to every Board of Health member. And every member also has the same Knox County email address algorithm, if you will, or protocol that everyone else has, which is first name dot last name at knoxcounty.org. So either way will work.
Do you want me to show it?
I was pulling it up.
Okay, you're sure.
I'm just looking.
It's at the bottom of the board.
Go back and share my screen. So
Could I ask this just occurred to me. So this is just for clarification, the resolution that we passed has the same revisit date as the one that we passed last week since we didn't change it. Is that correct?
yes. So I have pulled up, oh, not to me. Okay. Okay, sure.
That looks like a Teams page, not.
It's not what it's not what I was looking at, but Catherine's going to do it properly. I was going to show the Board of Health web page, so everybody can see what that is.
So it's here at covid.knoxcountytn.gov/Board of Health, and Board of Health is highlighted, as you can see at the top. But if you scroll down to the bottom, there's meeting agendas, the authority information about the board, membership, decisions, and then there's a form down here at the bottom that you can click on. And then once you do that, you put in your information, and that will be sent to every member of the Board of Health.
So it sounds like once a month public forum gives us a little bit of time to coordinate and iron out the details to make that a little more of an automated process than it was this time. And that was it. That was all I needed to bring up.
I would like to take this opportunity to thank Mayor Jacobs and the staff. I think that was a very nice public forum, very intelligent comments, well run. So thank you very much for that, and look forward to those in the future.
Well, again, thank you to all of you for allowing the time. Appreciate that.
Dr. Gocher, should we just inform people that we mentioned him, Mr. Sanders is now our attorney, just for the record, that David Sanders from the county law office is now the attorney for our board.
Yes, and David, I know you're not on video, but do you have any comments about that role or anything in general at the conclusion of this meeting?
I don't have any particular comments regarding the role other than what I hope to enjoy working with you all. And obviously any of you all can contact me with particular questions that you have individually, and I'll be glad to answer them and to help you draft what documents you need.
Thank you. Any other comments, any other business to come before the Board of Health this evening? If not, I'll entertain a motion for adjournment in a second.
So moved.
Second.
And we'll have a just acclamation on that. And thanks, everybody. I think we had a productive meeting this evening, and look forward to comments from the public actually this week. And I hope we're in the right direction. I think we are. Thanks, everybody.